Okay, I think now Marco.
What we used to do is to talk with men in the couples in order to try to understand what they want to know. So that way we shape the program and we change a little bit to fit to these needs. So many times men comes to us and say we don't want to be in the same group as our partners. So in other groups, they want to be together because women can translate the men's emotions. So I think the idea is to try to understand the group and adapt the methodology to each group. So that's the.
Men talking openly about their own personal issues, especially in the Rwandan or African context where issues around, sex and sexuality and all those GBV issues are like taboo issues. Of course, at the beginning when men come for the first sessions, they seem quite silent and don't talk about their own issues. But the program is designed in such a way they're meeting in 15 sessions, once a week during 15 weeks. Of course, for the first session, when they are meeting for the first time, it's really very hard to talk about those kind of issues. But as they keep on meeting, for the second, third session, they start opening and discussing, freely, because they have already have a kind of trust and confidence among themselves, and they start now talking and discussing very easily and very freely. And what you are seeing now is not only, because it's just a group of 12 men, and during the adaptation, they're the one who decided on which sessions they need their partners to come. So men only decided on when their partners will come and join them on the groups. And what we see about this, about sharing, openly their own or personal issues, is that they reach a point where they're even ready to share publicly their own issues in their families, So we're also inviting them sometimes to share publicly in big events in the communities. And even sometimes, in other events, organized at the community level. So they feel even proud to share, saying, I came from here and today I'm here and I'm also calling upon other men to change and become a bandebe or a role model like me. So I think it's a matter of process. At the beginning, of course, they don't talk, but at the end of the 15 sessions, they become open, free to talk, to share, and also, thank you.
Come to give, to put dollars on table. So what we did, some exercise we did on the government side, especially in the Ministry of Health, was to analyze how much we can have a return cost when we invest in reproductive health. There is some studies done by World Bank and WFP. When you invest like in family planning, you have a return on economic growth of, I think, 9% of your total economic growth. When you invest like in nutrition, you have a return economic growth, and also in reduction of maternal mortality when you invest. So we use that tool to convince the government, especially the Minister of Finance, because all is money. And then, all is money. And then for each government, when you provide evidence and the return you have on that intervention, most of the time the government by the program. Especially in Rwanda, we have a chance that more than 60% of members of parliament, they are women. So it's easy to pass the law. And also we find that when you explain either to the government, either to the community, either to the men, what they need to do, they understand. But especially when you explain to them why they need to do it, they buy it.
Not a question, it's a comment. I'm Fidel from Rwanda. I work with RWAMREC. I just want to comment about how we engage men in this battle. We need to be conscious about the language that we use in engaging men. So the communication is very important. So my colleague talked about one lesson. So actually, approaching men positively is the key to the right engagement. I was talking to a man who has participated in the fathers group, and he said, I quote, "I like this program because it doesn't blame us. Other programs have been blaming us, but I'm happy with this program. And since I've participated in this program, I'm actively involved in the care work of my family, and I have the following benefit. One, since I'm involved in care work with my family, I'm enjoying a healthy relationship with my wife." Then he said again, "Since I'm involved in this program, my child is working well, is doing well at school. Finally, I'm enjoying sex with my wife." So this is very important. So the language we use in engaging men, it is very important. Please let us not blame men. Let us engage them positively and use a positive language. Thank you.
Thank you.
Fathers and future fathers. Like, I want to know who are more ready to change, like the youth, the young people, or the fathers who are already fathers. Like, who are ready to transform themselves. If you have any experience and can share it. Thank you.
I can probably quickly share the Rwandan experience because I've been saying we're having fathers groups, expectant fathers, or fathers who are having just young children from 0 to 5 years old. And they're also having youth groups, young men and young women's groups. But so far what I've seen is that change, those who are, showing change and also benefit from the program is mostly the fathers being expectant or those who are having children. And I think it's because when you see the sessions, the way they are made, actually when you are dealing with fathers groups, it's something real, something that life that they are living on, on daily basis. But when I'm talking with the young men, the young women, just like projecting their future lives. So it's easy for the fathers, those who are already fathers, to change and to see the benefit from the program. Thank you.
Maybe I can respond that when we're talking about sharing care works to young people, because it doesn't relate to them, it doesn't interest them. So that's why we divide it. When we're talking with the fathers group, we use simple message like spend 30 minutes with your kids will change his life forever. For example, like that. We use it in our material kits. But with the young people, we addressing into the positive masculinity, how they interpret and masculinity value. For example, that through the bullying or violence or become a real man using violence. So the discussions within with the young people mostly is challenging them about masculinity. But then after that we also have the issue about fatherhood. But it's not something that we start with it. It's step by step.
Thank you. And she's going to give us some concluding remarks and kind of thoughts on where we're going in the future.
Thank you, Kay. Thank you very much, all the panelists, all the colleagues from the various countries, which I think offered us quite a colorful, to get the flavor of the various components of the MenCare Plus program. Maybe I feel like one had working the campaigning with the young people, although there was reference to it, has been missing a little bit. But I think it's important to mention that also is one of the components happening in all the 4 countries. For us, as you could see, it's very much about the plus. The comprehensiveness of all the various elements, as also Jane was introducing us to the theory of change. The moment we are able to make a change at all the levels, starting with the individuals, starting within the families, accompanied by cultural community changes by groups, workshops, campaigning, working with a wide broad of stakeholders as the example the example from Indonesia, working with religious leaders, very strong commitment in working together with the government. And I think we were very pleased with the example of Rwanda, making very clear that there's also a dollar sign involved. So be aware of your strategies to also address these kind of issues. And then the training of, as also Marco said very clearly, the training of health providers who are part of that same culture full of biases. So it starts with opening up minds. And I like very much to actually emphasize the last comment from the chair from RAMREC, and I think it was also, at least it was what we tried to let come out very clearly. It's very much the approach. And I'd like to really have the approach which starts actually with listening to creating that space for men to start listening to the stories. And I remember very well one of the men coming to counseling at Mosaic that what he actually said was that that's actually the first time that's asking someone to tell that someone is listening to my story. And it was actually a moving moment, because when you start realizing that, then it means that that's the first step for change, which is very much combined with the positive approach, the language. And I think in the past we were very used to either disciplining or telling men what to do, to use the condom, stop violating. And after starting listening to the stories, it's very much creating space for and enabling a process of finding positive ways of being a man, manhood. And that takes time. And that brings me to another element of what's very crucial in all both at intervention level, but also among the working, among ourselves, is the term relationship. And it's building new kind of relationships, breaking the patriarchal patterns from the past, which actually started with ourselves. And we just came out from an interesting discussion during lunchtime, a very informal kitchen table talk, where often the most interesting talks are happening. It was about building a new relationship with women's organizations on the one side, coming from, as also Karen explained quite a bit, from a very, a lot of women have been beaten themselves, and now they are counselors, and now they have to start working with organizations on gender justice with men, which takes time. And there was an interesting parallel with, it's like to restart dancing with each other in a new way, gentle, by listening, by opening up, by creating a safe space, which applies to us, among us, coming from various backgrounds, which applies with, as you said, with working with government partners. You don't always understand the same language, but be open about it and start to understand each other, where you come from. And it applies very much in our work in the communities, where it's men and women starting to reconnect in a different, more equal, non-violent way. And I think that process in itself takes time, which often you don't feel the time is there, because we have to work on our work plans, implementing, reporting. And one of the recommendations was also to involve donors in these discussions and to make them part of that transformative process, which is not only about outcomes. It's very much about a new way of working together, a process. Which brings me to invite you to our representative of our Dutch Ministry of Foreign Affairs, Mr. Marcel de Kort, who was there very much from the beginning when there was a sexual reproductive health call with a small minor subcategory that also projects could address harmful male norms transforming into positive male norms. So we thought that's our chance. Let's apply. We got approved. Marcel is here. He has this program in his portfolio. And I would like to invite you, Marcel, to, after listening to all the presentations, we have talks very regularly. And I remember you saying a couple of weeks ago that when we were asking, what do you get out of this program? Well, you said, there's one thing. You at least managed to make noise at the ministry, because everybody knows about this program. So I would like to invite you to give a little bit of feedback on what you're hearing, and also what it takes to make it more sustainable. We had some examples, but it would also be nice to hear from your perspective, the issue of sustainability. Welcome.
Well, good afternoon, everybody. I will be very brief because tea and coffee are waiting. It's great to have you here, full room. That's always good to see. So why did we decide to fund this program 2 years ago? And, you know, of course, it's the best answer is that Promundo and Rutgers WPF submitted a very good proposal. The competition was very stiff, and I think only 9 proposals were approved. So there was stiff competition, and they did a great job. And I have the feeling that we were right at that time for selecting this project. But I also have to commend one of the persons. He's not in the room. That's a pity. That's a Dutch consultant, Jan Reinders. He was one of the consultants we hired for the selection procedure. And every meeting he said, "Don't forget men and boys. Don't forget men and boys." And after a while, I got a bit, yeah, I know it, But, he was right. And it's a pity he's not here, But I think he was quite influential in that by repeating that all the time. I think it's what I like. I mean, the conference is now 1.5 days old, and I think this project perfectly fits within everything that has been said in the past 1.5 day. And I think that must make you proud of what you're doing and how effective it is. And I think it's very good. What I like, I had the privilege of visiting the projects in Cape Town earlier this year, and it was a wonderful experience, and I felt very welcome in Cape Town with Mosaic and Sonke. And someone asked about cultural differences, and I found it very interesting because the project is being implemented on 3 continents. The Americas, Africa and Asia. 2 are missing, Australia, but we don't fund projects in Australia, and Europe, of course, which is an interesting idea, how do these projects fit within a European context or Australian, Oceania. And I think I made the remark at that time when I was in South Africa, because we went to a township, and I think the Americans would call it canvassing, trying to get young adults for the counseling groups. And there was an excellent outreach worker, and we were discussing with 2 young guys, and after 10 minutes they were talking about their own sex life, which I thought, that's impossible in the Netherlands. We are quite tolerant, open country, but after 10 minutes discussing a sex life with someone completely unknown, and it's and that's the cultural element. And I think we heard today that there are a lot of similarities, a lot of elements of Mencare Plus work in different cultures, and there are also a lot of challenges that are very different within the cultures, and I think that for learning and for future development of programs, I think it's hugely important to learn from that and from that experience. And in that respect, also when we're discussing sustainability, I think there are a lot of elements that Rwanda can learn from Indonesia, and Indonesia from South Africa and Brazil. I think, for example, the involvement of religious leaders. I was at a session yesterday how to involve religious leaders in preventing gender-based violence, and someone said, "Well, we can't do this for a very long time, but religious leaders, they are there, the continuity, and we should involve them." And I think, all the elements of the project, like, the involvement of the Ministry of Health or the legal system or, health workers are extremely important for the sustainability of the projects, and we really have to find these, let's say, agents of sustainability and to identify them and to make sure that the programs the elements can continue after the program will end at the end of 2015. Lastly, I think that was the fascinating proposal that I said, you know, 3 continents and Europe and Australia, Oceania are missing, and we already discussed how can we implement this program in the Netherlands itself, because I think there's a great need for that. I'm at the Ministry of Foreign Affairs, so I don't have anything to say about it, but there were discussions with WPF, you know, how can we, what can we learn from all the experience in the 4 countries to implement in the Netherlands? And I think that would be, that's a great idea of development cooperation, that we can learn from you, and and hopefully we can materialize that in the near future, that we can experience MenCare Plus in the Netherlands too. Thank you for being here.
Much longer process, but I hope you got at least a kind of impression, flavor, interest. How you can find us easily. Sorry?
Come to the booths.
Yeah, come to the booth outside where there's a lot of more material. I'd like to really thank you for your being here, and looking forward to further exchange. Thank you.